This is news many parents have been waiting for. Kids 12 to 15 could actually get a COVID vaccine as early as this week.
Just yesterday, the FDA approved Pfizer's COVID vaccine for kids as young as 12. That means clinics and doctors are getting ready now for an expanded rollout. So joining us live with what parents need to know and families need to know is Dr. Madeleine Gagnon from Gillette Children's Specialty Health Care. Good morning, doctor. Thanks for being here.
Good morning. Thanks for having me.
We know obviously we're waiting on the CDC approval of this, and then things will really start to ramp up. Obviously, the big question parents want to know, is it safe? Is it safe for kids 12 to 15?
Well, certainly as a pediatrician and a mother myself, I am overjoyed by the FDA's news yesterday and excited to hear more from the CDC tomorrow. But this vaccine from Pfizer has gone under extensive clinical studies with more than 2,200 children and proven to be incredibly safe and very effective in children ages 12 to 15.
Okay, so you'll be encouraging your patients to get vaccinated. And what is the top of the list? I mean, it does seem kind of obvious, but, you know, what do you tell your patients?
You know, certainly we want to be here to address concerns. Parents naturally have questions, as they should, about their children and what's in their best interest. So we want to help get the information out there about why the vaccine is safe. We also encourage families to talk to their children. Many adolescents have strong opinions, and this is a way to help them get back to their pre-pandemic life. Kids are looking forward to indoor sleepovers or birthday parties, and this is a way to get back to some of that sense of normalcy.
We know, generally speaking, COVID-19 has not impacted kids as severely as it has adults, but we're seeing kind of an uptick in the number of cases involving kids recently. So still important for them to get it, even though they may not end up in the hospital. Kind of what's your take on that?
You're exactly right. Most children thankfully do incredibly well with just mild illnesses. But unfortunately, it does happen that some children do develop severe complications from COVID. And in rare cases, unfortunately, some children have lost their lives. So nonetheless, it is important to vaccinate your children. It also helps decrease the spread in schools and out into our community. Certainly, we've seen sporting events be super spreader events. So kids are not exempt from COVID, unfortunately.
Well, and we know we talk about this a lot, but it's still important that we know the cases are declining. That is good. More regulations are lifting. But what are you saying to families about masks and social distancing? What do they need to know that maybe some aren't getting?
You know, certainly we are still in this pandemic, and so we must continue the hand hygiene, the masking, the social distancing when possible. But that is a reason to get the vaccine. And certainly some families are navigating that partially vaccinated state where the parents may be vaccinated and the children aren't. If your children are eligible in the coming days and weeks, please vaccinate your children, because it allows you an opportunity to have greater mobility in the community, to have people into your home, and it allows you to relax on some of that masking and social distancing between two vaccinated parties.
I wanted to ask you about this, doctor. You hear from families that say, okay, I've been vaccinated, the adults have been vaccinated, but they kind of want to wait and see when it comes to their kids. They're not super eager to have their kids get it right away. What would be your pitch to them to tell them not to wait? What would you say to maybe patients that have that concern?
You know, certainly, again, wanting to validate their concerns. As parents, we naturally want to do what's best for our children. But I would say that the clinical studies are incredibly reassuring on the safety profile of this vaccine as well as its efficacy. Additionally, of course, that's why we have regulatory bodies like the FDA to undergo review, as well as the CDC Advisory Committee. So again, multiple layers of checks and balances that have vetted this safety of this vaccine. Additionally, I encourage families to reach out to their pediatrician and get that additional reassurance and information they're looking for. But at the end of the day, I incredibly encourage folks to get vaccinated and look forward to the time that I can vaccinate my own children.
Yeah, and it sounds like potentially 2 and up could come this September too. So then a whole nother group of kids too would be eligible. All right, Dr. Madeleine Gagnon, thank you so much from Gillette Children's. We appreciate kind of picking your medical brain. Thanks so much.
Thank you.
Thank you.